El siguiente ponente, Teymur, please, whenever you want.
Thank you very much. So thank you for the organizers for inviting ECDC and me to this meeting. So I'll be focusing a lot of my talk on a couple of things. The first thing I want to show you is some overview of the epidemiological trends of HIV in Europe and Central Asia. I want to focus my presentations on how we are moving towards achieving these 90 targets, which Bertrand talked about yesterday. I'll focus specifically on HIV testing and treatment. I'll try and answer the question whether or not Europe and Central Asia is on track to end AIDS according to those targets that all countries have signed up to. And if time permits, I'll say a few words about PrEP implementation in Europe to set up PEP's talk following mine. So just to show you that WHO Europe categorizes our region into West, Center, and East according to these categories. A lot of my presentation will look at these differences within these subregions. And the history behind this is that historically in the West, transmission has been driven by men who have sex with men. In the center, it's been driven by heterosexual contact, and the East by people who inject drugs. This is slightly changing, but still in our epidemiological reports, we report against these three regions. So in 2016, we had more than 160,000 people who were diagnosed with HIV in this region. 16% of these cases were diagnosed in the West, only 4% diagnosed in the center, and a full 80% diagnosed in the East. So Russia alone accounted for more than 100,000 of these cases. So Russia really is the area that's driving the epidemic in our wider European region. You see the rates per 100,000 at the bottom of these circles as well. Looking at the distribution of new HIV diagnosis in 2016 by subregion, you see here that men who have sex with men are the main modes of transmission in both West and Center, whereas in the East, it's heterosexual contact followed by people who inject drugs. So we're going to be needing very different responses in our region to be able to tackle these issues. Another really important issue is in the West, 45% of all diagnosed cases occur among those who are born in a different country than the ones they're reporting in, what we refer to as migrants. This is a really important population for us in the West, and we're not doing enough to reach this population. Only 9% are born abroad in the center, and very few in the East are born abroad. So this is data from UNAIDS showing you the estimated new infections, and the good news is that this is decreasing globally from 2.4 million cases in 2007 to 1.9 million cases in 2016. But if we superimpose the European data on top of this with a different scale on the right, you see the scale here, we see that we are the only region globally which is moving in the wrong direction. And if we split this blue line up into Center, West, and East, we will see that what's happening in the European region is basically driven by what's happening in the eastern parts of the region. The whole increase is happening in the eastern parts of the region. And in the West, the green line, you see a pretty stable line over the past decade, and the blue line in the center, very few cases, but still a quite significant increase, and I'll show you that later. So moving on to these 90 targets, we talked about them yesterday, so I won't go into each one in detail, but these are the targets that everybody has signed up to. And the idea, according to UNAIDS modeling, is that if we reach these targets by 2020, at least 73% of all people living with HIV will be virally suppressed. The target then is to move to 95 by 2025, and by virtual elimination by 2030. So those are the targets that we're working towards. In terms of availability of data, we started monitoring this at ECDC in 2014, and you see these green bars on the data availability. They've improved quite a lot in our region in a very short amount of time, so this is really good news. The biggest problem we've had in our region is to provide solid estimates of the number of people living with HIV, and this is still where most of the work is being done to try and provide really good estimates. And soon I saw some of her slides providing published estimates for Spain, which is really good news. So this is a problem area, and we've developed an ECDC modeling tool to help certain countries who don't have the capacity to develop their own methods. The second area where we're facing big challenges in is this area of viral suppression. And this goes to the issue of that the people that we work with are public health people, but the data comes from the clinical side. So a lot of you people in the room sit on this data on ART and viral suppression. And I think in Spain, this collaboration works very well, and you're able to provide good estimates. But in many countries in Europe, this collaboration doesn't work very well. So over the past couple of years, we've invited clinicians and public health people from countries which don't have data to sit down and see if we can work together with them. And that's improving quite a lot. But still, this is the area where we have least amount of data. So now I'm going to start with the first target. 90% of all people living with HIV should be diagnosed. So how are we doing? So as you see on the top, 39 countries are able to provide data on these estimates. The overall percentage is 80%, and the countries in green are those countries that have reached this target already a few years before 2020. We see a number of countries in blue that are above the regional average and we think are on track to meet these targets. And then the further right we go, the bigger challenges they are going to have to meet these targets. And you see Spain, the latest reported data to Spain was 82%, so very much on track, I would say, to reach this target. So that means in our region, 1 in 5 people living with HIV in Europe and Central Asia do not know that they are infected. So this is really important. Looking at the differences within our regions, 86% have been diagnosed in the West, and this drops to 76% in the East. So we have different challenges. And when we look at the differences within our subregions, I think this is really important. We see significant variation, especially in the central and eastern parts of the region. And I think this is important to point out, as there are countries in both center and east which are doing really well, much better than many countries in the West. So I think it's important to highlight those differences. So we have a proportion, 20%, who are undiagnosed. But then those who are diagnosed late. And I saw the slide from Asun just now, and I think they're very similar numbers for the whole region. They represent what's happening in Spain. So as you see here, 51% are diagnosed late in Europe. And if you look at some demographics, if you look at subregions, we see that if you're in the eastern parts of the region, you're probably going to be diagnosed later than if you're in the west and the center. Quite small differences between gender in the full region, but if we look at the EU specifically, this is much bigger, where women are diagnosed later than men. In terms of age groups, the older you are, the more likely you are to be diagnosed late. And if you're a heterosexual or injecting drug use, a lot of heterosexuals are in the migrant group. They are diagnosed later than men who have sex with men. And in the EU region, which we also have data on, we look at country of birth. And migrants born in sub-Saharan Africa and Asia are diagnosed much later than other migrants from other regions. So this is the proportion that are diagnosed late, which is a really important group. So what do we need to do to decrease late diagnosis? Well, we really need to cut down the time between HIV infection and diagnosis. And we've used our modeling tool to publish some estimates showing that approximately there's a median time from infection to diagnosis about 2.9 years. And this is going down in all subregions, which is very good. But as you see, in the west and north, these blue countries have lowered a shorter amount of time than countries in the south and the eastern parts of the region. But this is positive news in general. So what do we need to do to reduce this time? We need to really improve our testing strategies across the whole region. So we ask countries, are you including these innovative approaches around community-based testing, both by medical staff and non-medical staff? Are you considering issues around home sampling and self-testing? And as you see in this red box, many countries have not included these issues in their national testing guidelines. It doesn't mean that it's not being done, but it's not really fed in its way into the national guidelines. So a lot of countries are starting to adopt their national guidelines, which is very positive. To find some positive news, in 2017, only 2 countries included it, so it shows us that some more countries are taking this issue of self-testing forward, and I'm assuming in the years ahead, these issues are going to be more commonplace in our region. So moving on to the second target, once you are diagnosed, are you on ART? So 39 countries have data on this in our region. A few more countries, 10 countries have reached this target. The overall percentage is 64%. a big chunk of countries are in blue here, above the target, the average, and on track to reach this overall target. And as you see, Spain is doing very well here. The vast majority of patients who are diagnosed are put on treatment in Spain. At the AIDS conference this summer, UNAIDS published global estimates. So they estimate that 79% of all people diagnosed are on treatment globally. And therefore, the surprise of 64% in our region is quite surprising, and many are very struck about this. I'll show you some more data about this going forward. So that means that 1 in 3 people in our region are diagnosed and then not put on treatment, which is very surprising. Looking at the differences, again, between the subregions, more than 90% in the West, less than 50% in the East are on treatment once diagnosed. Again, looking at differences within the subregions, you see huge variations, especially in the center and in the eastern parts of the region. So this is where ART policies become really important. In 2014, the vast majority of countries in Europe started treatment at 350 cells, orange here. With the START trial coming out in 2015, both EACS and WHO published new guidelines recommending test and treat. And very quickly, many countries adopted these policies. And we're just about to publish the new data for 2018, showing now that the vast majority of countries have adopted test and treat policy, which is very, very good news. But there's one thing about adopting these policies, and there's another thing about implementing. And what we're going to see now in the next couple of years, hopefully, is that we're going to start implementing these policies and see many, many more people put on treatment. What we've done for the first time, just because we have such great data, is to look at the comparison of treatment coverage depending on which year you adopted test and treat. So only 4 countries had adopted test and treat in 2014, and the treatment coverage in these 4 countries is 90%. An additional 16 countries with data adopted test and treat in 2016, and also very high treatment coverage. And those that just introduced it recently have lower coverage. This is not surprising, it's quite logical, but it's quite nice to see the data about the correlation between when you adopt policies. And basically my main point here is that early adopters of progressive policies and interventions have better outcomes. We all know this, but this is very relevant for treatment. It's relevant for testing, self-testing, home sampling. OST, opioid substitution therapy, is still very low in most parts of our region. Needle and syringes are still illegal in some countries in our region. PrEP is not implemented in many countries of our region. And it's just the fact that if we adopt policies as soon as the evidence is there, we're going to have better outcomes, and I think that's a key message. This is another example that's showing you that more than half the countries in our region do not provide treatment to undocumented migrants. So there's a population in Europe today that aren't even entitled to treatment. So that's very surprising figures. We've monitored this for a couple of years. We've tried to publish this issue and make noise. There's no real evidence that this group is very large and carry a big burden of HIV, but we do know, everybody in this knows that the clinical benefits of providing treatment, the public health benefits of onward transmission is reduced, the cost effectiveness is much cheaper to pay treatment early on than it is too late, and then the human rights perspective, of course. This is quite shocking for our region, I would say. So moving on to the last target. So once you are on treatment, are you reaching viral suppression? Here we have 33 countries providing data. The average is 84%, so this is the target we're doing best on. And this is no surprise either, because we know that treatment is very effective if you're on effective treatment. A lot of countries have either reached it or are very close to reaching the target. There are some countries here which we need to look into why this is happening. Is this a monitoring issue or is it a fact? Again, Spain down here doing very well, have reached this target, I would say. Again, big differences in our region. 93% have reached viral suppression, only 75% in the eastern parts of the region. So this means that if you've reached these targets, as I said, at least 73% should have reached this goal. And as you see, 33 countries again have data for this. We have 6-7 countries that have reached this target. halfway through, I would say, from Malta to the left will probably be on track to reach these targets, but the other half that have data are not going to be reaching this. It's going to be a huge challenge. And as I think Maria Prince talked about yesterday, there is evidence coming out that this 73% is not going to be enough to reduce incidence in our region. Andrew Phillips published a paper recently suggesting that you probably need to reach 90% here as well to have an impact on incidence, especially among gay men. So just looking at these targets and how close we are, we can't be comfortable because it's not going to be reducing incidence sufficiently quickly, we think. So this means that 3 in 5 people living with HIV in Europe are not virally suppressed, and I'll focus on this group shortly. But before then, just showing again the big differences. This is where the big differences come in our region. So in the West, we've reached this target of 73%, 46 in the center, and only a quarter of people are virally suppressed in the eastern parts of the region. Again, here we see less variation within the regions, but yeah, big differences anyway. So are we on track to end AIDS? So UNAIDS they suggested these targets and countries have adopted them. So here you see estimated new infections in the wider WHO European region, but also in the EU, EEA specifically. And this is what the estimates look like. And the target is to reach a 75% reduction in new infections by 2020, and the baseline is 2010. This is what the targets are. And we've looked at this and tried to calculate what does that mean for our region. Are we going to reach these targets? And the answer, of course, is no. To reach a 75% reduction by 2020 means a huge drop in the next 2-3 years. Even for the EU, where we have approximately 30,000 cases a year, this has to drop to 5,000-6,000, and that's not going to happen. So these targets are very ambitious, but still, as you see, especially at the regional whole, we're even moving in the wrong direction. In the EU, we are starting to see declines in many countries, or several countries, including, UK, especially what we're seeing in London. But this is promising what's happening in Europe, but we're not going to be meeting these targets. So in terms of the 90-90-90, then, are we going to reach these targets? These are, again, showing you the overall percentages of our region. 80% are diagnosed, 50 on treatment, and 43 viral suppression. And again, just to show you these numbers that were published this summer, ART coverage of all people living with HIV is 59% globally, and we're at 50% in our region. But again, huge differences. In the West, we are very close to reaching these targets, and we'll probably meet them, have met it when it comes to viral suppression. But when it comes to the center, and especially the East, you see where the biggest drop-off happens is where ART and viral suppression. This is where the big problems are. So also something new that we looked at is community viral load impacted HIV diagnosis in Europe and Central Asia. So you saw the trends, I've talked about them before, and now we're going to look at viral suppression. In the West, 73% viral suppression, as I said before, and we're seeing a 20% decline over the past decade, this green line. For the center, viral suppression drops from 73 to 46, and we see a huge increase from very low levels, but still a big increase in this region. And in the East, only 26% viral suppression and a doubling of the rate per 100,000 population. So we can't really make a correlation here. We can just put the viral suppression rates for one point in time and look at the trends overall. So what I want to do now is focus on not those who are virally suppressed, but those who are not virally suppressed. So those with transmissible levels of virus in their bodies, okay? So based on the data we get from all these countries, we estimate that 1.2 million people are living with transmissible levels of virus. And these people belong to 3 different groups. So either you're undiagnosed and therefore have not reached viral suppression, or you're diagnosed but not on treatment, or you're on treatment but have not reached viral suppression. So these are the 3 groups you can belong to. So what we want to look at is the distribution overall, first of all, and then by subregion. So looking at the overall data, we see that the majority of people in Europe belong to this blue group, that they are diagnosed, but they're not on treatment, 51%. Secondly, a third of people are undiagnosed, and then we have a small portion who are not yet viral suppression but are on treatment. So the good news is that 50% of 1.2 million people, that's 600,000 people that could be taken away from this pie if we just implement our policies on putting them on treatment, then they would disappear from this pool. So this is actually quite, we have the tools, we can easily do this. The big challenge is going to be reaching these undiagnosed, and that's what we're struggling with, especially in the western parts of the region. And now we're going to look at sub-regions, what the proportions look like. And as I said, in the West, approximately 200,000 people are not virally suppressed. Half of them belong to the undiagnosed fraction, and that's why testing becomes so very important. And in the center, this circle should be smaller, but you can't see the percentages. Only 15,000 people. The majority belong to this blue group. They're diagnosed, but not on treatment. And in the East, the vast majority belong to this group of treatment again. So testing numbers seem to be good. They test everybody in many countries in the eastern parts of the region, but they don't put people on treatment. So again, quite easy to address this issue by implementing the policies that most countries have already implemented. Finally, on the continuum, just to show you that very few countries are able to disaggregate their general population continuums by key populations. Only 10 countries have disaggregation for men who have sex with men, 8 for people who inject drugs, and only 5 for migrants. And just to show you what the general population continuum will look like for the same 10 countries, as you see for MSM, they're actually performing a little bit better than the general population. For people who inject drugs, the big problem, of course, is ART, and for migrants, they're performing worse all 4 steps, but it's only 5 countries, so I think we should be careful with this analysis. But the end point here is that we're trying to encourage countries to work on disaggregating their data to inform action. So to conclude, we see significant variations along the steps of the continuum of care between and within sub-regions of Europe and Central Asia. While we're quite close to reaching these targets in the West, we're very far away in the central and eastern parts of the region. And in terms of priorities, of course, testing is a key priority. We know what we're seeing from London now, where they're seeing significant drops among HIV in gay men in some clinics in London. They're attributing that to a lot of testing that's happening, a change in testing culture. They're not only testing the right people, but they're repeat testing constantly. And once they are tested, they are linked to care. And as Maria said in Amsterdam, often the same day they're linked to care. And I think that's happening a lot in Madrid also, if I'm correct. But this is 2 key priorities, of course. The more people that are going to be put on treatment, the more important of providing support and in retention and adherence is going to be. I focused a lot on the continuum of care, and we really need to focus a lot on prevention. It always gets very little attention, has always got lots of little attention, but this is really important that we try and work with primary prevention. And there are efforts in Europe now looking at quality of life issues. They don't want to stop with viral suppression. They want to think about the long-term impact of how it is living with HIV, and they're working on measures to develop those things. I've got 2 minutes left. I'm just going to continue with a few PrEP slides. Just to show you the latest map that we have on PrEP implementation in Europe. This is a very difficult map to do. 2 years ago, it's quite easy. We're just trying to see what's happening, but it's much more complicated now. So we have a few countries in dark green where PrEP is implemented and reimbursed through the national health system. So we have France, Norway, Sweden, Scotland, Portugal, Croatia, Moldova, Georgia, I think, are the countries. And actually Israel should be in dark green as well now. We have a few countries where there are ongoing pilot projects. And I spoke with a colleague here yesterday. It's kind of misleading because it shows you that there is a huge pilot project in Spain where it's available, but we know that's not the case. It's only 200-300 people, and Pep will talk about this in Catalonia, but it's the same. So we need to rethink this map a little bit to provide you the correct information. But things are happening. A year ago, this was much more red than it is today. So things are happening, and especially in this light green, the generics one, showing that generics are being made available at affordable cost, 40 to 50 euros, and doctors are prescribing it. So that's positive. We wanted to understand what the numbers are of how many people are using PrEP. So we teamed up with Hornet, which is a gay dating app globally, which has 25 million users. And we rolled out this PrEP survey last year to get an understanding of how many people are using PrEP. So we've done this twice. In 48 hours, we got 13,000 respondents the first time. The second time, we got 12,000 respondents from all countries across Europe. It's an amazing tool. We asked, are you currently using PrEP? 10% of respondents said, yes, we are using PrEP. 90% said no. We have disaggregated data, so if you're interested in the Spanish data, I'm happy to share that with you. PEP has seen that before. The important question, we have lots of questions, but one of the most important is, well, where did you get PrEP? And the vast majority, 34%, say they got it from their doctor or through internet, okay? And when you try and look at formal versus informal use of PrEP, you see that the majority, 54%, are acquiring their PEP through other mechanisms than the healthcare setting. And that's because it's not available in countries. And if it's not available, they're going to get their hands on PrEP anyway, these guys. They're very innovative. There are tools out there to find it. So we want them to move from informal to formal, and that's why implementing PrEP across Europe is so important. Another key question, I'm almost ready now, does your doctor know that you are taking PrEP? And this shows you that 1/3 of gay guys on Hornet, on PrEP, have not told their doctors that they're on PrEP, so they're not being monitored properly. So this is a really important issue as well, and that's because it's not formally implemented. And finally, just to ask, how likely are you to use PrEP in the next months? This is really important for us to understand. And for those currently not on PrEP, 22% said, yes, I'll probably use PrEP. A big proportion haven't made their mind up yet, so interesting. And if you look at those currently on PrEP, the vast majority are very happy with that and are most likely willing to continue with their use of PrEP. So to conclude, formal PrEP rollout in Europe is quite slow. There is evidence of significant informal use across European countries. A significant number of men are using PrEP informally and not telling their doctors about it. And many questions that I didn't go through, the right people are selecting PrEP. So there are people who are taking high risk are using the PrEP. And finally, men using PrEP are more likely to have used PEP, been screened for an STI, been diagnosed with an STI, and reported chemsex use, and they're also much happier with their sex lives. So it's the right people that are using PrEP generally. So a lot of this data that we have is really fantastic. It's really a pleasure to work with. A lot of people across Europe provide this data to ECDC that need to be acknowledged, as well as colleagues at ECDC and some conference. So thank you very much.